po. So, yung topic po natin ay pagpapatuloy ng foundation, yin and yang, relationship 2. So, let's see the chronic stage. Either yin or yang energy is deficient. Energy in a weaker position would not be able to control the other side effectively. Dominant side, therefore, can increase from time to time, thus causing several semi-acute stages. So yung po pag chronic na, 'di ba, nakikita natin yung yin and yang nawawala na siya dun sa normal level. Kaya pag may dating mahina yung kanyang organ, halimbawa yung kanyang kidney ay merong dati ng lamig, so dati nang yung mataas na yung yin, pag na-expose siya po lalo sa sa lamig, tataas lalo yung yin niya. Kaya andun po minsan papasok yung several semi-acute states. Pag semi-acute po, lumalampas dun sa normal level, either yung yin or yang. So tingnan po na, kasi pag acute stage, karaniwan po dyan ay excess condition.
So ibig sabihin, pag chronic state, Ma'am Mildred, mukhang napagod na siya sa control.
Opo.
So yun, pag deficiency, it's probably always chronic, no? So
wala na sa normal level.
So for the benefit of yung mga parang ngayon lang pumasok, so nakikita natin yung transition from acute, then yung transitional phase, tapos yung chronic, di ba? Pag acute, talagang masigasig pa, no? So,
full pa yung yung
humahabol, ano pa yung energy.
Lumalaban pa.
Lumalaban pa. Then, doon naman sa tinatawag nating transition stage, which is probably nasa 6 months, no? Yung bago mapagod, andun pa yung state na yung isa excess, yung isa deficient, which makes sense, di ba?
Yes po. Yan. Sa mga next slide natin, mas mapapalalim. Sa example dito, yung recurrent migraine headaches provoked by too much stress, light or alcohol, or yang causes, good example of yang rising from time to time on yin deficient. Halimbawa nga yung kung pag recurrent na, kasi papasok na po siya dun sa papunta na siya dun sa chronic kasi papaulit-ulit na yan eh. So possible pong bumababa na yung isang, halimbawa pwede nang bumaba yung kanyang yin at yung kanyang yang ang mas mataas na. For example po nito, yung iyong liver ay dati nang may hit na kasi magagalitin ka. Yan. Tapos inom ka pa ng alcohol. Kaya possible na tataas, pag tumaas yung yang mo, makakaramdam ka ng kirot ng ulo. Basta tuwing panahon na nagagalit ka or nagkakaroon ka ng intake na nagbibigay ng heat, babalik yung migraine mo. Yun, tataas yung iyong yang. At dahil sa paulit-ulit yan, yung yin mo ay bababa. Nagdi-deficient na.
So ibig sabihin, Ma'am Mildred, kasi napaka-common nito yung migraine, di ba? Paulit-ulit. So siguro yung clinician, yung practitioner, should always advise kung ano yung mga options, paano maka-avoid ng stress, no? And I'm sure marami po kayong suggestions on how to deal with stress. Kasi as long as yung buhay natin stressful, you cannot expect na mawawala yung migraine headache, di ba? Or parati kang exposed sa mga maliliwanag, like yung mga parating nanonood ng, alam niyo naman ngayon, yung mga devices natin, di ba? Masyadong, di ba? Tapos alcohol pa. Ang daming mga drinks na alcoholic, di ba?
So diyan papasok, Doc, yung mga napag-aralan natin ng mga nauna na, pag alam mong may ganyan kang situation, alam mong i-handle yung emotion mo. Saka yung food mo, yung dapat conscious ka sa food. Huwag kang kakain kung alam mong marami ka ng heat, huwag kang kakain ng mas warming food. Kasi kahit ina-acupuncture ka, pero kumakain ka ng mga warming food, ang dami mo nang hit. Halimbawa, yun nga,
Yes.
umiinom ka ng alcohol, ng
Oo.
alak, tapos konting ano lang, sisigaw ka
Nauubusin.
na, galit ka na.
Nauubusin, di ba?
Opo.
Kasi puro na lang yang. So dapat dinadagdagan mo ng yin.
O, pag
Ah,
marami kang yang,
Yes.
magbawas ka na at kung mababa yung yin mo, yun ang ano,
Oo.
pataasin mo.
Kasi
Halimbawa, sige po, Dok.
kasi ang nangyayari ngayon, 'di ba? Nagpapa-treat lang, umiinom lang ng gamot, and then yung lifestyle niya ganun pa rin, no? So kailangan talaga natin yung mga tao talagang concerned sa kanila. You know what I mean?
Yes po. Dapat naiintindihan at ine-explain din natin sa pasyente. Isa pong example pa nito, halimbawa yung nag-hot stomach, pag alam niyang may hot stomach, siyempre papayuhan na natin na avoid yung mga nagpapahit sa tiyan o siyempre yung mga chili. Tapos pwede na silang kumain ng mga cooling food, yung mga halimbawa yung pipino, maganda yun. Cooling food din po yun. So,
singkamas.
opo, yung singkamas. Sa halip na
Yes.
kakain sila ng chichirya na full of oil.
Oo.
So, inaano na natin yun doon na, kasi kung gagawin nila, mas madali yung ano, yung pag-balance natin yung nung yin and yang nila.
Siguro si Doc Ana could relate so much here, no? Kasi I
Ah,
think ang daming mga patients na parating may migraine. So kung hindi masyado ganun kagaling, kung hindi ganun kalawak yung pag-uunawa ng practitioner, like of course you would always ask, ano ba ang nangyayari nitong sa bahay ng pasyente? No?
Yes
So kung
po.
parati
Doc,
kayong away, yeah, parati kayong away ng away, so probably you would have to look at that. Kaya nga dapat you have to establish a very strong relationship, no? A bond with your patient. Ibig sabihin, you really care kasi this is not just about needling eh. Do you agree? Do you have anything to say, Ma'am Arnel, Ma'am Ana?
yes po, Doc. I'm just thinking also, di ba I said I told you before with regards also sa nutrition during the time of pregnancy because that affects from the very beginning if it's not if there are no supplementary way of caring for it for the during the pregnancy, it will last until lifetime. So nakasali na yun. So
Hmm.
other part pa, yung stem cells natin, it depends on the age also.
Yeah.
So there's a lot of things na we must have to explain to them, information dissemination. Depende rin
Precisely.
also with regards to the nutrition ng tao at saka yung lifestyle nila, no matter what, di naman nila iniintindi yun. Kung
Totoo.
magninidal lang tayo,
Kailangan.
sometimes yung mga practitioner hindi pa perfect doon sa kanilang nininidle, mas lalong effect nun problema. Kailangan talaga may mind setting din meaning that yung in my own opinion that masyadong malawak to importante talaga yung mindset ng tao,
Mm.
how they're gonna go on their own health issues and all those things. Environmental, ang daming problema.
True.
Doon pa lang sa
Yes po.
environmental pa lang, how about yourself?
Can you imagine living in let's say, nagpapa-therapy ka, no? You receive, what's this, mga advices, mga ganun. But when you get home, andun yung mga toxic na mga tao, and then when you open your
Exactly.
Facebook, and you know what, Facebook natin, yung device natin, talagang the light itself can actually aggravate things, right? So,
Yes po.
what I'm saying is, if we are if we really want to help the patient, dapat we should go beyond acupuncture. You should really look into, yeah, yung mga, okay, avoid Facebook, maybe do something else, do more gardening, and then instead of eating a lot of yung mga foods na talagang, alam niyo naman pagkain ngayon, puro deep fried, puro alcoholic, di ba? So these are the things that you have to really, really consider. Because what we wouldn't like to happen is madideplete na yung yin. No? So
Yes
can you
po.
imagine, pag na-deplete na yung yin, so you already go into the chronic phase. So I'm very happy na we have, yung mga ganitong situations which are actually very common.
And
Yung
also po, Doc, I'm just thinking also na each and every one, they're saying, this is good exercise, this is good exercise. No, it's not like that. Unless you are well, that's the time you can exercise. Kasi hindi ka na pwede
Precisely.
mag-exercise kung hindi ka naman fully
Yes.
well.
Oh, yeah, and also when you exercise too much, nagde-develop ka ng heat, di ba, Ma'am Mildred?
magde-deplete din po yung chi pag too
Oh.
much.
Pag too much. Kasi you get to sweat a lot. Di ba?
Opo.
Kasi bakit ka nagsusweat? Ang daming heat eh. So lalo
Yeah.
kang magyayang.
Mas lalo
So
siya
pwede kung deficient
magkakaproblema.
ka, then gumagalaw ka, nagagamit mo lalo.
Yeah. I see I know someone kasi she lives alone. And what she does, sa gabi siya nagda-jogging. Pero ang buhay niya talagang, stressful. So parang it doesn't make sense. So jogging siya
Pero
ng
yeah, kahit po even walking lang that is also called an exercise. Just to relax your mind.
just to
Kasi,
relax.
opo. I mean,
So what can you say about yung mga they go to the gym like 2-3 hours and you sweat a lot and then pagkatapos mong mag-gym kakain ka ng puro.
Tapos magagalit ka.
bawal. Tapos
Exhaust ang
may away.
energy.
Tapos you will have a stressful life.
Yeah.
Pareho rin yun.
Yeah. So yeah, and this is very interesting. Let's go to the next example, Ma'am Mildred.
Yung ano ko po, Doc, yung isang dito, kasi napakahalaga ngang maintindihan nung mga pasyente natin at mismo po ng practitioner. Dapat talaga holistic yung approach nung pag-ano natin. Napakahalagang naipapaliwanag natin sa pasyente at mismo yung practitioner din.
Palawakin
Nagagagap
yung
niyang
ano mo.
maigi, opo. Kaya
You
hindi
go
pwedeng
beyond.
symptomatic approach lang na itong masakit tusok, di ka
Precisely.
umiimik. Pag di ka
You go
umiimik sa
beyond the
pasyente
needing.
mo, babalik at babalik po yan.
Yeah.
Yung isang technique po, Doc, na ginagawa namin nun, pag na-interview ko yung pasyente, malalaman natin kung sino yung toxic sa bahay nila na nagiging cause ng sakit nila. Minsan po sabi ko, ano kaya, pwede kayang siya ang kasama mo pag punta mo rito. Minsan po gano'n yung technique, sinasama nila. Then, habang nagpapaliwanag tayo, naririnig yung toxic na nagbibigay sa kanya, nauunawaan, natutulungan po siya, yun, saka nagre-recover.
True.
Malaki pong bahagi dun yung paligid nila eh.
So
And
yung
sorry.
Sige po,
Importante
Dr.
din po yung family therapy. That's very important kasi kahit na anong gawin mo at nandun pa rin yun, kasama mo o kaya katabi mo. Sometimes,
Hindi mo naman
asawa
pwedeng
mo.
paalisin.
Hindi
Asawa
mo
mo.
pwede paalisin. Di ganun din po yun.
Tusukan mo na lang or pressure.
For all you know, yung family, the whole family will
Yeah,
into
exactly.
you, diba?
Totoo po yun.
What we want to emphasize here is you just don't look at the patient as a case, as a the way they treat patients at hospitals. Diba? They don't even
po,
remember your name.
Yeah.
Sorry.
What I'm saying is, I'm injecting in with my patient yung spirituality.
Yes po.
True, because it's very yin.
Exactly po.
Something meditative, no? Something, even the music, I'm trying, ewan ko lang parang sumasobra na tayo. I have a patient, sabi niya sa akin, every time he listens to yung mga chants, yung mga parang sabi niya, I could find some solace, some comfort in, so ibig sabihin may effect pala yung mga soothing
Sounds.
sounds.
Yes po, Doc. Yes, kasi yung main po natin
exactly
di ba nire-receive niya.
Interesting. O, diba?
Pati nga po yung di ba yung mga
healing.
mga scent.
Yeah.
Yun.
Siguro expert dito sa healing sound si Ma'am Nits. Siguro she should give a talk. I'll probably, CA naman si Ma'am Nits eh. I will recommend you magpipresent ka sa PAI on one Saturday. Healing sounds. Diba?
Yes po. Calming sound.
Research ka na, I'll give you 2 months. Ay, tall order. Okay, let's go to the next example.
Okay po. Recurrent asthma with excessive mucus or fullness of chest in wet and cold weather. For example, for yin or damp increasing from yang or qi deficiencies. situation. Ayun po yung sobrang hina-hina ng chi, ng lungs. Talagang pag nagbabago yung yung weather, pag uminit or lumamig, nagkakaroon sila ng asthma. So, lalo pa kung marami na dating cold yung kanilang lungs, mas mataas yung yin. So, basta't nagbago ng lumamig, ayan, mag-aasma na. Ganun po yung
So
dating pasyente ko
nauubos
eh.
yung yang, nauubos yung
Opo,
yang.
nako-consume.
Oo, okay.
So, ayan. The changes are always predictable because a chronic yin deficient state can only lead to yang increase from time to time and vice versa. So malalaman naman natin talaga yung mga sign and symptom ng pasyente kasi pag yin deficient, makikita mo yung marami siyang heat. 'Di ba? Yung pag tiningnan po natin yung pulse, syempre, pulse ay fast. Pag tiningnan mo yung tongue, yellow coating 'yan. Pag pumunta na din sa hyperactive yang, thick na yung kanyang tongue. Kaya napakalaga yung diagnosis natin para nakikita natin eh. Yan. So pag nag-hyperactive po yung yang, nag-e-excess siya kaya yung nagkakaroon siya ng full condition. Parang ang stage na to ay parang acute.
Lumalala, no? Lumalala
Opo.
siya.
Tumataas muna siya, tumaas.
So ibig sabihin itong pag naging yin ka, ibig sabihin nawalan ka na ng yang. Ganun ba 'yun? So kung meron
Pag
kang
naging
yin
deficient
deficient.
ka po, bumaba, 'di ba? Ang example nga natin diyan halimbawa yung sa umaga, pag nasa normal siya, then pag gumalaw ka na, nako-consume na, gumagana na yung mo,
So kailangan na
energy.
niyang gumalaw.
Basta't gumalaw na po, 'di ba? Yan, nagkakaroon ng deficiency.
Okay.
Pero yun na yung na-topic natin nung mga last topic natin. Kung dahil lang sa yung pag external factor na hindi naman talaga dahil gumagalaw ka lang kaya nagagamit mo, pag kumain ka, magba-balance uli yan.
Okay.
Pero kung weak yung organ mo, kahit kumain ka, hindi siya nagba-balance.
Okay, good. So you have to really move.
And how about po yung mga sedentary ang mga life nila?
Well,
lalo na po
that's
yun.
something that we have to deal with. Alam mo, ang napansin ko lang, no, of course, lahat naman tayo tatanda. And I noticed that yung mga seniors, they just watch TV na lang all the time. Para bang,
Wala nang movement.
wala na, puro na lang Siguro we should come up with something interesting to make them, kasi can you imagine, hindi mo gumagalaw?
Activities for the seniors.
Yes, or probably they can do qigong, and it's always good to do it with somebody else, like a group. Siguro in the future we have to really create parang awareness na kasi pangit naman mag-iisa ka na nagchi-qigong, no? But if if you're aware na hindi lang kayo mag-isa. So we're really working at that. And I'm very interested in sound therapy.
Tsaka parang combination po ng mga therapy. Kasi hindi lang pwedeng isa lang eh. Kailangan may mga combination.
Yes. Para i-maximize na, para sa, para mag-benefit naman yung pasyente.
Tsaka para po mas mabilis gumaling.
Opo.
At saka take note, may mga doktor stress na stress. They're not exempt from illnesses.
Yes po, kasi nga mas maraming gawain ng mga doktor eh. Gusto na magpahinga, di pa rin makapahinga.
At saka yung the mere fact na everyday punta ka ng ospital, puro toxic, you absorb all the negative energy.
And yung pagbabiyahe lang po toxic na yun eh.
Yeah, tapos.
Yung traffic.
Opo, dyan sa Manila, mas grabe.
Grabe dito sa atin. Dito I live here in Metro Manila. Yun toxic na yun.
Opo. Yung ko po dun sa isang sharing din po, kasi may matanda po kaming pasyente, ilang matanda to. Ngayon ang ginagawa ko po, tinuturuan ko sila kasi yung sigong mas magandang galaw dahil dahan-dahan siya kahit matanda okay siya. Okay. So talagang kailangang i-incorporate natin sa kanila na may session talaga na nagsisigong yung mga pasyente natin. Pag nandun na sa ating clinic or sa ating kung saan tayo nanggagamot, ini-schedule lang po na pag gising sa umaga, ito yung gagawin. So pag sinusunod po nila, talaga yung chi, nagmo-move, mas madali po yung nila, recovery. At na-obserbahan din po nila yun, na
Pero
maganda pa merong sabay na mga exercises.
yeah, pero I'm just thinking also po, with the condition, with what is happening in our whole life, world na kailangan talaga may spiritual therapy. Kasi doon lang sila natatahimik in a way na nakukulang kanilang internal system at ang kanilang mind. Pag hindi cool yan, wala talagang problema. Malaki
Oo.
talaga ang problema niyan po eh.
Ang impact nito global even
Yes
universal.
po global
Oo.
Lalo pa ngayon pong napakatindi ng inflation rate. Mas matindang stress sa
Grabe,
mga
ang
tao.
mahal-mahal. Nakakainis.
Oo. Actually po minsan
Kailangan
yung
may
post,
relax ka.
Oo.
yun yung post
And then
bakit,
ang dami, yeah, sorry.
yes
Go
po.
on.
Yung situation lalo natin dito sa Pilipinas po, observation ko dun sa mga nagiging pasyente namin. Pag in-interview ko kasi, ganito ang hirap ng yung stress nila, talaga yung kahirapan
Buhay
ng
mo
buhay
naman.
ngayon, yung inflation rate na nararamdaman. Kaya tama ka ma'am, sasamaan talaga natin anumang religion sila, talaga ako sinasabi ko, kahit anong religion po kayo, involved kayo sa church kasi makakarinig kayo ng healing sa inyong spiritual para tulungan yung inyong katawan. Kasi yung mind yun mind bababa sa ng
Yeah,
katawan,
exactly.
re-react.
Marerelax sila.
Anything spiritual will give you more yin. No, diba? No matter what faith.
Yin na yin po yun eh.
Sige, let's continue.
So, yeah, it can help. Really, it can help.
Definitely,
Yes
yeah.
po. Ang yin and yang relationship sa tao, napakalaga na maunawaan. So, in energy balancing treatment, the diagnosis is half the treatment because we decide the points accordingly. So, yun. Acute condition must be sedated. So, pag lahat ng, di ba yung acute nga, dapat nating pababain, i-balance ito, tanggalin yung mga sobra. Dapat ibalik natin dun sa level, sa natural level. So, if yang is excess, sedate yang. If yin is excess, sedate yin. So, kaya pag nakita natin na acute, alam na natin yung gagawin, kailangan munang mag-sedate ako kasi acute to So, if both are excess, sedate both yin and yang. So, yung pareho nating isi-sedate. Whichever increase first. Naalala ko po dito sa sedation, kasi may mga acupuncture points po tayo. Halimbawa, nakita natin na yin is deficient, pwede mo pong gamitin yung water point para lumakas yung kanyang yin. Pwede rin pong, kung yang ang excess, pwede mong gamitin yung fire points ng kasi yung mga points po natin, di ba, may
Ang tindi na. Ang galing mo na talaga dyan.
may madali pong hanapin na points pag yung fire points, isedate mo po yun. Halimbawa po ng fire points ng large intestine is large intestine 5.
True.
Pag alam natin na may heat yung colon, pwede mo pong tusukan yung large intestine 5, din isedate po yun. So
we will
napapawasan po yung heat. Natatanggal.
So we'll invite you next week kay Dr. Gavino. Puro naman din yung mga 5 shoe points. So, yes.
Karaniwang ginagamit ko to, Doc, yung elemental points, pero effective po. Tapos, hindi ka masyadong nag-isip, ano ba dapat mong gamitin?
Memorize mo na lahat, no?
Fire is fire, gumagamot sa fire. Nagsisedate din siya. Yung water, nagpo-cool siya, pwede rin siyang mag-ano dun sa fire.
Pag sa sea, nilalagay mo na siya sa dagat pag sobrang ng init, di ba?
Opo.
Okay.
Yun. So, yung chronic condition po, need to be tonified. So, pag chronic, ito tonified natin. At alam naman natin yung lahat ng earth point ay nagto-tonify. Kaya, basta't alam natin yung mga earth point, gamitin natin pag alam natin na chronic yung condition. If yang is deficient, tonify yang. If yin is deficient, tonify yin. If both are deficient, tonify both. So, yun po, pag nakita natin, alam natin yung mga points natin na gagamitin na nagto-tonify. Para yung tumaas sila uli dun sa normal level ng energy. Kasi pag narating nila uli yun, mawawala yung karamdaman. Siyempre, hindi lang sinasabi natin, hindi lang 50% ang mga manggagamot yung healing at 50% sa pasyente nakasalalay. Kaya kahit tinusok mo, kung hindi sila susunod, di sila gagaling. Pero pag nakipag-cooperate silang pareho na sinunod yung patient advice, minsan isa o dalawa lang natusok, magaling na sila. Kung hindi grabe yung sakit. Okay. When both yin and yang are in excess, it is open because one side increased initially. And the other side react to this increase by increasing itself as well. Parang yung mga pinakita na natin pong yung mga drawing po ng yin and yang na pag yin ang tumaas, ay yung pag yin tumaas, yung yang nagdi-decrease. Kasi nga talagang 'di ba yung relationship nila interconsuming, intersupporting din. Yan. This reaction is possible as this is a recent disease state and both energies are still healthy. So kung bago pa lang po, pag tumaas yung yin, lampas dun sa level, tumataas din yung yang kasi yung mga antipathogenic energy natin, lumalaban yun sa mga pathogenic factors. Makikipagsabayan yun. Kaya pag bago pa lang yung sakit, di ba, minsan nag-fever ka, then bigla kang papawisan kasi tumaas yung mo Kung tumataas yung yang mo, tumataas din yung yin, lumalaban yun. Pag acute pa lang. Pero pag tumagal na, bababa na yun. Yun, magkakaroon na ng imbalance pag pinabayaan mo. So, it will not be possible for the opposite side to react with an increase in itself. If the disease state is subacute or chronic, as this side would have become weaker over time. Ayun. Yun na po yung sinasabi natin na pag tumagal na, di ba yung napag-aralan natin nung nakaraang topic, ang acute is 1 day to 30 days. Tapos yung subacute, 1 month to 6 months. Tapos yung chronic, pagkatapos na po. So kung pinabayaan mo na, magiging chronic, magiging weak na po. Magiging weak na yung either yung yin natin or yang. At minsan yun na yung napakahirap ibalanse. Kasi minsan sasabihin ng pasyente, ba't di ako gumagaling, tinusukan mo na ako. Kasi nga nasa chronic stage, ang dami mo nang inaayos, binabalanse. Tapos matigas pang ulo, hindi sumusunod sa patient advice. Yun yung problema minsan. Pero pag naintindihan nila na dapat talagang kailangan silang tumulong para gumaling ang katawan nila kahit po chronic, yun, natutulungan nating maibalance yung yin and yang ng katawan.
Hello.
Yes, ma'am?
Can I add? Siguro
Yes,
kasi, no matter what, whatever we are going to do to them, kung walang mga closure ang mga problema ng mga yan mentally, mental acuity kasi, hindi din everything talagang para mag-blast lahat yan eh. Kapag I think you know what I'm doing, I have a patient now, siya, president siya ng isang magandang club, so whatever. So I told her everything and all those things. Ay nakikita ko pa rin sa kanyang sa kanyang Facebook na ang dami-dami niyang kinakain na kung ano-ano, tapos ino-open niya pa yung problem niya sa husband niya. Something like that. So no matter what, wala ring effect. Siguro hindi kaya only my suggestion na i-counsel muna yung tao talaga kasi pabalik-balik yan eh hanggang hindi nawawala ng closure yung kanilang whatever is in their mind. Ano pa rin niya, sa bagay okay lang, sige, punta kayo ng punta, I will earn, di ba? But then it's not good also as a person na you want to heal someone, I want to help, and then they are not healing. Ganun at ganun pa din. Kailangan mapasukan ng...
Counseling should be part of the management, no?
Opo.
Alam mo po, Doc, mas malaki pa yung problema nila kaysa doon sa mga kino-complain nila eh. Mentally talaga.
Oo, for all you know, doon nagmula doon nag-originate. So, if you cannot address the problem, so paulit-ulit yan hanggang sa siguro isang taon mo na tinitingnan yung pasyente.
Exactly.
Pag ganun po, talagang i-refer na sa psychologist or sa psychiatrist. Tutulong. Kailangan may katulong na.
Ang problema, denial naman. They are on denial. Walang they cannot accept that. Some others are doing that.
Tusukan mo na po yung heart niya.
Tusukan mo din yung niya, do 24 and Gall Bladder 13. Ilalabas niya. Talagang sige, sabihin na niya. Sometimes you will get to know things na hindi mo alam na sasabihin niya.
Madidiscover mo na lahat.
Yes.
Opo. Itonify
In-open
mo
up
po yung
niya.
mga weak.
Do 24 and GB13, promise.
GB13.
Sige.
Okay, talagang napaka broad po talaga ng role ng mga acupuncturista.
No,
Kailangan po
actually, alam nyo,
holistic
this is part and
talaga.
parcel of sa totoo lang, this is what everyone should do. No? Kawawa naman yung pasyente. And time will come, people will be so very conscious who to approach. No? Hindi, this is not just needling eh. We need somebody who is
Yes po.
so well-rounded, so broad yung approach. Sabi nga ni Dr. Anna, sabi niya, we need someone who could integrate all the strategies, no? Para ang panahon kasi ngayon mabilis na eh, no? Parang everybody has access to everything, and if you got stuck to the old school way of wala tayong papupuntahan eh. Kawawa naman yung pasyente.
Kawawa po talaga. Pagpasok pa lang minsan ng pasyente, nakatingin niya sa taas, tinitignan yung mga gamit mo.
Yeah.
Parang doubty na.
Totoo.
Kakaloka.
Yes. So can we continue, Ma'am Mildred?
Opo. Kaya parang, na-imagine ko lang, Doc, yung clinic natin na tinatayo. Yung mga clinic natin na holistic approach. Na tulad nga nung inano ni Ma'am Nitz, may healing sound ka, may ano ka, di ba yun yung mga
Andun na
aroma
lahat.
na
Andun na lahat.
nakaka-healing.
Oo. Mm-hmm.
Holistic talaga. Okay. Subacute states need both tonification and sedation. So bago pa lang po yung sakit, kasi nga talagang excess condition yan, so kailangan nating i-sedate. Halimbawa po itong hyperactive yang, tonifiyin and sedate yang. Ano yung example natin pag hyperactive? Halimbawa may full heat in the liver, ito yung mga taong magagalitin. So makikita natin dyan yung kanyang, siyempre mga heat yung makikita natin pag full heat in the liver, red eyes, pati face, tapos yan malalakas po yung sound niya, ay sigaw, malakas ang salita. Tapos pag gumagalaw din yan, mga fast. So ang kailangan nating i-sedate yung yang. So sa mga i-sedate mo po yon. Pag may stagnation of yin naman, tonify yang and sedate yin. So pag nakita mo po nag-stagnate, ang una mo nang gagawin i-tonify mo muna yung yang. Yan. Palakasin mo yung pataasin mo hanggang makarating sa level. Tapos, i-sedate mo yung yin. Paano mo malalaman na nakarating na sa level pag nawawala na yung mga nakikita mo sa kanya? Nababalance na. So, in recurrent states, with chronic history, treatment is different depending on whether we treat during acute phase or at interval. At interval, treatment is only to tonify deficient aspect. So pag interval daw po, mag-tonify ka lang doon sa mga deficient. Halimbawa nakita mo ay ang heart yin deficient siya, adi yung yin deficiency, hahanap ka ng points para matonify yung heart niya. O yung sinishare ko po, magaling mag-tonify ang heart point. So, during acute phase, treated like in subacute stage. So, pag acute phase, ito yung mga full falls, lahat excess condition po to. So, yun ang sedate din yung gagamitin natin. Increase of both yin and yang with symptom of both energies can be treated with sedation of energy that increase initially. When this is sedated, reacting side will decrease of its own accord, as it will not be necessary for it to oppose any excess. Example, feeling hot and sweating excessively. Pag nasa yung healthy stage ka pa, di ba, pag tumaas yung yin mo, ay yung yang, ang gagawa, tataas din yung yin. Yun, kaya nagkakaroon ng, yun nga, yung feeling of hot, tapos nagsusweat. Kasi yung anti-pathogenic factor mo, malakas pa, lumalaban siya dun sa pathogenic factor. Kaya may ganun na nararamdaman. So, okay. If yang can be sedated and body is cooled, there would be no sweating. Pag yung situation naman daw po, halimbawa, napataas mo yung yung yang, yung nung tinusukan mo, na sedate mo, napababa mo na yung yang niya, so mag-no-normal level, so yung yung anti-pathogenic chi mo, hindi na yung lalaban kasi nag-normal siya kaya walang sweating. Hindi magsusweat ang ating mga pasyente na kasi pa-normal mo na So both yin and yang are always within its entity and they always relate and react to each other. This reaction follows as predictable pattern. So yon, knowing this pattern help to treat patient's problem. Kaya alam natin kung deficient siya, kung deficient ang yin, siyempre makikita natin puro hit yung pattern. Pag deficient naman ang yang, puro cold yung pattern. Kaya alam natin yung gagawin natin. Acupuncture is based on a way of nature, on wisdom, achieved through many years of observation of nature, human life, and its changes. Kaya talaga yung panggagamot ng acupuncture, nakabase to sa sa nature. Yung example nga natin ito na kaya dapat ang mga acupuncturista at yung mga pasyente, inaano din natin na maging laging aware tayo sa ating environment kasi yung environment ang laking bahagi sa ating kalusugan. Halimbawa, pag pinababayaan natin ang ating kalikasan na nasira, magkakaroon ng unbalance yung yin and yang ng environment at malaking epekto to sa kalusugan ng tao. Siyempre kung wala ng puno kasi laging pinuputol, adi init ang mundo. Pag uminit ang paligid, ayun, yung yin and yang ng katawan ng tao ay affected. Yun. Idagdag po. So, understanding of yin and yang and their interrelationship will help us observe, predict, prevent, and treat symptom of disease in their changing phases. So, pag naunawaan natin ng pasyente, ng mga manggagamot, yung interrelationship ng yin and yang, madali nating makita at ma-prevent kung paano, halimbawa, nakita na natin na, yun nga, magagalitin siya, alam natin na pag magagalitin, iinit yung atay. Pag uminit yung atay, sa Sheng cycle, ipapasa lahat nun yung init. O, kaya pwede na nating may advice siya, paano ma-prevent yun? O, huwag kang magagalitin kasi ito ang pwedeng mangyari sa'yo. Pag lagi kang nagagalit, yung stomach mo iinit din. Papasa niya doon. Pwedeng yung sabi nila, ito po ba yung parang hyperacidity nararamdaman na kakakain pa lang gutom na naman. So, napipredict natin na pwedeng ganun mangyari doon sa organs ng mga tao na may ganitong attitude. So, pwede nating gamutin sa pamamagitan ng nakikita nating mga symptoms. Okay, this relationship are contradiction or ito yung opposition, interconsumption, control, enter-transformation. May YouTube si Doc, napakaganda ng explanation nito. Pero kung
Take up
i-relate
din natin
natin,
yan, di ba, dito?
opo. Pag sige, Doc.
I just hope that everybody will take this seriously because this is exactly what we will be encountering in our clinical practice, no? Kailangan na natin mag-level up because our patients deserve only the best. And time to really move forward, time to really have a more global mindset para maging competitive na po tayo sa ating mga counterparts internationally. Ang yabang, no?
Opo, pagpatuloy na nag-aaral at inuunawa ang yin and yang, magiging magaling na mga practitioner.
Yeah, even if meron tayo niyan, it's still, we're open for discussion sa contradiction. Okay? And this will be because of the expertise of Ma'am Mildred.
Yung contradiction, ang sinasampol ko lang po dito na madali nating maunawaan, di ba, laging pag sumikat ang araw, lumulubog siya. So may opposition ng from yin to yang.
I-discuss natin yan tomorrow.
Opo. May pang mas detail tapos
mga examples.
Sa
you can invite anyway this Zoom is free. Everyone is invited to encouraged to invite their colleagues para naman lahat tayo.
Para sa advanced knowledge po, napakaganda ng mga YouTube na sinesend ni Doc. Pakinggan po natin yun.
Thank you po.
Sobra, I learned a lot from there kasi nakaka-relax.
Yeah, although yun nga, kakasawa yung boses. But anyway, it's so good to get comments from other countries. Kasi sabi nila parang, So mayroon na pala tayong following. O, di ba? So yun.
Yes.
Anyway, mamaya na yan kasi we need to we need to move forward. Thank you very much, Ma'am
Opo,
Mildred.
thank you po.
Alam ko, this is your passion to really hone the skills, not only sa skills mo, but lahat na nagpa-practice ng acupuncture. Maraming salamat
Opo.
po. And thank you, Ma'am Ana, for really sharing your thoughts on how to maximize all the modalities para naman para yung pasyente mismo mag-benefit. Thank you po.
Thank you rin po.
Thank you po.
Okay. I'm sure wala nang magtatanong. We will now go to tongue diagnosis and straight from Zamboanga, who will soon be transferring or migrating to Manila. Ay, naku, napaka-marites naman, no? Okay, anyway, let's welcome Ma'am Teresita Sumile for tongue diagnosis. Good afternoon, Ma'am Teresita.
Good afternoon po, Dr. Hector and classmates. Welcome po sa tongue diagnosis. Ang topic po natin ngayon is still the continuation of our topic last Thursday, dry and white or yellow coatings. Our first patient is male, 29 years old. Tongue description po ay pale red, white, small horizontal cracks, greasy, dry, yellow coating. Symptoms are foul smelling, loose diarrhea and flatulence, inner restlessness, sleeping problems, and inability to concentrate. Western diagnosis, we have none. Background to disease, caffeine abuse, and stress from failing examination. Chinese diagnosis are retention of damp heat, slight deficiency of fluids, accumulation of heat in the yang brightness or yang-ming channel with injury to the fluids. Retention of damp heat in this case is reflected in a normal tongue body color with white tongue body shape. Slight deficiency of fluids is manifested in a small horizontal cracks. Okay, now as we can see in the tongue picture, the coating is greasy, dry, and yellow, resulted from a background of caffeine abuse and stress from failing an examination, leading to symptoms of foul smelling, loose diarrhea and flatulence, inner restlessness, sleeping problems, and inability to concentrate. All of these attributed to accumulation of heat in the yang brightness or yang-ming channel with injury to the fluids. Okay, now let's go to the case history of the patient. After twice failing to graduate from university, Mr. B began to experience inner restlessness, insomnia, and the inability to concentrate, all of which prevented him from retaking the examination. He tried to compensate for his lack of concentration by taking stimulants like guarana products, a dried paste prepared from the seeds of Pollina cupana and used as an astringent, and consuming as many as 15 cups of coffee daily. His stools became loose and foul smelling, and he suffered from flatulence. The white tongue showed a yellow, greasy, and tongue coating. His pulse was excessive and rapid, so it is very clear that there is heat. Okay. Analysis. In this case, the excessive study and thinking, as well as the severe disappointment of not graduating, gave rise to heat in the heart. Surprisingly, this was not visible on the tongue. Rather, the tongue reflected only the abuse of guarana and caffeine. Those two substances can, if taken in excess, injure the kidney yin and the fluids through enhanced diuresis. The injury to the kidney yin resulted in a disturbance in the harmonious communication between the kidneys and the heart, which is reflected in its inner restlessness and insomnia. Okay? The yellow, dry, greasy coating reflects the intense heat in the lower burner that has injured the fluids. This is visible in the cracks as well as in the thin coating in the center of the posterior third of the tongue body. The smelly loose stools were the result of a retention of damp heats in the large intestine. Here, the heat is more dominant than the dampness. Okay? The full and rapid pulse confirms that this condition is one of excess. Now, the appearance of a dry, rough coating is caused by damp heat, wherein the heat is more dominant than the dampness. Here, the heat injured the fluids in the stomach, resulting in the dry, rough coating. In this case, it is important to clear the heat and increase the fluids. The patient was therefore given dietary counseling and encouraged to eat more moistening foods like pears and less hot and spicy foods. Okay? Now let's go to our second patient, female, 43 years old. Tongue description, pale red, curled down tip, right-sided dry yellow coating. Symptoms are skin rash at the waist, brownish skin pigmentation with itchiness, urge to urinate and drinking of urine, tinnitus, inner tension, and depressive moods. Western diagnosis is tinea corporis, and background to disease is physical and mental exhaustion. Chinese diagnoses are normal, heat from deficiency in the heart, retention of damp heat in the gall bladder. Alam na po natin lahat na ang normal tongue body color is pale red, okay? So, heat from deficiency in the heart. As we take a look in the tongue picture, the tongue tip is slightly curled down, and the patient presented symptoms of inner tension and tinnitus resulted from physical and mental exhaustion, okay? Now, retention of damp heat in the gallbladder. As we can see, the tongue has a right-sided dry yellow coating from part of the anterior third down to the posterior third. Patient presented symptom of skin rash at the waist, brownish skin pigmentation with itchiness, urge to urinate and dribbling of urine, and depressive moods. All of these signs and symptoms attributed to retention of damp heat in the gallbladder. Okay? Now let's go to our next patient. Female, 62 years old. Tongue description, red, dry, thick, greasy, white at the sides, dirty yellow coating in the center of the tongue. Symptoms are dizzy spells, tingling and numbness of the arms, pains in the shoulder and lumbar region. Kidney deficiency. As we look at the tongue, it has red body color and dry, resulted from overwork. Accumulation of cold dampness with blockage of G in the middle burner, transforming to heat. This is manifested in a thick, greasy, white coating at the sides with dirty yellow coating in the center of the tongue, resulted from excessive consumption of fatty foods, leading to symptoms of dizzy spells, tingling and numbness of the arms, and pains in the shoulder and lumbar regions. Yun lang po. Thank you so much for listening.
Thank you very much, Ma'am Teresita. Do we have any questions? Okay.
Clear po.
Yeah, do you have anything to share, Ma'am Mildred?
Clear na po. Maganda yung
Clear na.
pagkaka-discuss ni ma'am.
Oh, very, very, very comprehensive. Maraming
Thank you po.
salamat, Ma'am Teresita. Okay.
I have something to say.
Sure. sure.
Po.
Yeah.
Ay, Ma'am Teresita, see you soon.
Ay, okay po.
Ay, wow,
Happy for
nag-ano sila.
ma'am.
Mamay,
She will be staying in Marikina, di po ba, ma'am?
Ano, ma'am, sa Cainta po, Cainta Rizal.
Kaintay. Yeah, I see you soon. Thank you so much. Yun lang
wow.
po.
Papracticum na po siya
Ang
dyan
dami
sa
na niyang
Lam sa
bar-
Manila.
Ang dami na niyang
Wow.
barkada. Okay.
Ayan person.
Oo, malay mo magkaroon na rin ng partner si Ma'am Teresita. Ay,
Yeah, they will be together.
yes.
Yes!
We can join.
O sige na, tuloy na tayo sa next.
Okay po.
Thank you po.
Maraming salamat po and Ma'am Teresita. Okay, next we go to diagnosis by interrogation. We will continue with the sleep topic, and today we will talk about excessive dreaming and somnolence. So let's study on strategy. Let's take up the strategy on how to elicit this from patients. Okay, too much or excessive dreaming is usually due to a pathogenic factor agitating the ethereal soul. So this is like liver, no? Liver issue. So this may be either a pathogenic factor like fire or phlegm fire or empty heat resulting from deficiency. Now, napakahirap daw i-define ang excessive dreaming because it is a normal thing, no? It's a normal physiological aspect of sleep. Okay? And wait lang, nawala yung aking sandali lang po yeah. And it's really a challenge, no? How you are able to elicit this. And kailangan, you would know kailan mo itatanong to. So from the perspective of Chinese medicine, when you say excessive dreaming, this is a level of dreaming, it can be pleasant or unpleasant, that makes the patient very restless or it wakes the patient. Okay? Under this category din, nagbibilong ang nightmares, lalo na pag recurrent. Other doctors, they define excessive dreaming as waking up with unpleasant feeling from dreaming. So normal dreaming is not remembered in the morning. So usually nare-remember natin pagkakaiba yung dream, di ba? Okay. So excessive dreaming is this can mean wandering at night. So wandering in one's dream, moving in one's dream. No? So these terms are a clear reference to the wandering of the ethereal soul at night when we dream too much. So if you dream too much, you would always look at a liver issue because if you have liver blood or liver yin deficiency, you cannot settle the ethereal soul. And ethereal soul is something to do with, moving. It's about vision. It's about plans, aspirations, things like that. So with the exception of heart and gallbladder deficiency, excessive dreaming is caused by a full or excess condition of the liver or the heart. Examples, liver fire, heart fire, or phlegm fire in the heart. Full conditions of the stomach can also cause excessive dreaming, especially phlegm fire in the stomach and retention of food. And this is where your expertise on really looking at the tongue will come in very, very, will be very, very useful, no? So to summarize, the main patterns that cause excessive dreaming are, okay, liver fire. So ano dito, may nightmares, may restless sleep, headache. And kung nakikita nyo, talagang yung tongue yung basehan, di ba? Okay, so if you're thinking of liver fire, we would look at the very red side. Of course, the red on tongue, and the sides are redder, and the coating is dry and yellow. So the pulse would be, okay, we all know that, but liver wiry shot and rapid would denote heat or fire, no? So pag heart fire naman, if you look at the tongue, it's the tip is redder. Of course, the tongue is red, the tip is redder, the coating is yellow. The pulse would be exuberant or overflowing, no? Or bounding, we call it, overflowing. Rapid pulse because of the fire. Okay, so restless sleep, and the main component that will distinguish this from liver fire would be the presence of palpitations, and there is also insomnia. Okay, phlegm fire harassing the heart. So ito lumalakad na po ang ano, yung parang nagigising ka na, no? Restless sleep, insomnia, waking from nightmares, palpitations. I'm sure some of you can relate to this, no? Agitation, sputum in the throat because of the phlegm. And when you look at the tongue, it's red, redder tip, sticky yellow coating. Pulse, slippery, that's very, very phlegm, no? Overflowing, the fire, rapid. Phlegm fire in the stomach. So I don't know if you have any comments. I think this has something to do with yung mga mahilig mag-midnight snacks, no? Oh, tapos ang dami pang kinakain. Okay. So can you imagine you'll have agitated, excessive dreams, restless sleep, then you have burning epigastric pain, insomnia, and the tongue is red with sticky yellow or dark yellow or even black coating. And meron ka makikitang stomach crack, and I believe you already know what that is. Rough, sticky yellow coating inside it. So that's very, very phlegm heat, no? Phlegm fire. Slippery, rapid, and slightly overflowing pulse on the right middle position. Then we go to heart indeficiency with empty heat. So you will be looking at the tongue without coating, right? Yun. Indeficiency, eh? And empty heat, red yung tongue. Okay, so when you feel the pulse, it's floating and rapid. Okay, so dream disturbed sleep, insomnia. See, we need to really focus on tongue. Liver indeficiency naman with empty heat, this time you would have associated symptoms like blurred vision, dry eyes. So this is very liver. Red tongue without coating. So the key word here is without coating. Remember, this is indeficiency. And I think the only way you could tell if this is liver or heart is the symptoms, right? No? Blurred vision, dry eyes, that's very liver. Floating empty, slightly rapid pulse. Then we go to heart and kidney indeficiency with empty heat. So this is more of like, disconnect between the heart and the kidney, between the fire and water. So when you look at the tongue, definitely you'll not see any coating, diba? And there's a crack, as you can see, midline heart crack, no? Floating empty. And by the way, hindi po lahat ng may heart crack would have this, kasi there are naman people na they have a heart crack, but the coating is still intact, diba? Yun. It simply says that you're not supposed to get stressed because magkakaroon ka talaga ng issues. Okay? Palpitation, so this is very hard. Dizziness, tinnitus, kidney, right? And the pulse is rapid or deep weak on both rear positions, relatively overflowing on both front positions. I think this is very easy. Next, we go to heart and gallbladder deficiency. Ito yung mga taong pag nagising hindi na makakatulog ulit, no? So they wake easily from dreaming and absent-minded, emotionally unstable. So this is very concerning. So this will be a challenge to the practitioner, okay? Anxiety and palpitations. So to summarize, excessive dreaming, these are the possible patterns that you will see. Diniscuss na natin yan, so no need to enumerate them. Let's now go to somnolence. Somnolence naman yung dozing off frequently in the daytime or early evening. Tulog na lang ng tulog. The patient wakes up as he breathes out and then dozes off again. So it includes some people's physiological need of sleeping a longer time than normal, which is approximately 7 to 8 hours in adults. Somnolence may be due to deficiency, qi and or yang deficiency, or to an excess like dampness or phlegm. Okay, the most common situation is a combination of deficiency of the spleen and or kidneys, and a full condition consisting of dampness or phlegm. So if the patient complains of somnolence, you should first inquire about the working hours ng patient. Baka naman, nag-work siya habang ang ibang tao tulog. Diba? Kasi if the patient works very long hours, somnolence is then not a pathological symptom. Understandable yon kasi gising siya during ito yung tinatawag na graveyard shift. So, spleen yang deficiency, there would be desire to lie down, loose stools, pale tongue, weak pulse. Kidney yang deficiency, so there would be listlessness, backache, dizziness, tinnitus, tongue is pale and swollen, deep, weak pulse. Dampness, okay, yung mga nakaka-relate dyan, pagkatapos kumain, inaantok. That's very dampness. And they feel heavy. They wouldn't like to do anything at all, tulog agad, no? Sticky coating. So when you look at the tongue, it should be sticky ang coating, slippery pulse. Pag phlegm naman, of course, somnolence after eating and in the morning, tulog na lang ng tulog. Parang hindi na hindi mo na pwedeng kunit sa kama. Muzziness of the head, dizziness, swollen tongue with sticky coating, and slippery pulse. I hope everybody now has learned some technique on how to elicit somnolence and excessive dreaming from patients. Any questions? Okay. I hope that was clear. Next, we go to pulse naman, yung mga seryoso talaga dyan. And we would like to call on Sir Dino na nanggaling pa po sa Legazpi. Buti naman may time siya ngayon. Good evening na pala. Good evening, Sir Dino.
Good evening, Doc. Good evening, classmates. Today, ang topic natin is firm pulse. May sound, Doc?
Clear na clear po.
Yes.
Clear.
Okay. The firm pulse is felt only at the deep level. So, ito yung pulse na mas ramdam po siya sa deep level. It feels hard and it combines with qualities of full, wiry, and long. It is basically a pulse that is wiry only at the middle and deep level. Pag wiry and firm, mas ramdam siya sa middle and deep level. Hindi siya superficial na pulse. The wiry pulse can be felt clearly at compared sa kung wiry lang po siya, ramdam po sa 3 levels po ang wiry pulse. Sa clinical significance, the firm pulse generally indicates internal cold, often causing chronic pain. It may also indicate accumulation in the interior, stagnation of qi, or stasis of blood. It is a pulse quality that is associated with abdominal masses or abdominal pain, and it may also indicate blood stasis deriving from cold. So, firm pulse. A pulse that is firm on all 3 positions of the right or on both middle position of the left and right indicates blood stasis and a pathology of the penetrating vessel. A firm pulse quality is relatively common, especially in women. Common conditions presenting with a firm pulse include chest painful obstruction syndrome, convulsion, abdominal masses, abdominal pain, menstrual disease, and arteriosclerosis. Sa firm pulse, clinical significance, meron tayong 3, internal cold, blood stasis, stagnation in the penetrating vessel. Sa combinations, pag firm and tight indicates internal cold, possibly with edema. Pag firm and slow naman indicates internal cold and blood stasis. Pag firm and choppy denotes blood stasis. Sa differentiation of similar pulses, sa wiry, wiry pulse and the firm pulse share similar characteristics of being hard, full, and long. The main difference is that the wiry pulse is felt clearly at all level. So ramdam po ang wiry pulse sa tatlong level, whereas the firm pulse is felt only at the middle and deep level. So yun po yung difference. Pag tight naman, the tight pulse and the firm pulse share similar characteristics of being hard and full. The main difference is that the tight pulse is felt clearly at all levels. So ramdam po yung tight pulse sa all levels, whereas the firm pulse is felt only at the middle and deep level. So parehas ng wiry and tight, all level po sila nararamdaman compared sa firm pulse, which is the middle and deep level lang. So thank you po for listening.
Thank you very much, Sir Dino. So if there are no questions, we will proceed to differential diagnosis. And let's call on Ma'am Neats. Good evening po, Ma'am Neats.
Good evening, Doc Hector. Good evening, everyone. How's my audio, Doc?
Very clear po.
Medyo maingay lang po ang aso.
Okay lang. Ano aso mo, madam? Ay, sorry.
Madami, Doc. May pag, merong
Sige, mamaya na yung aso.
Mamaya. Nagbebenta ng aso yung anak ko, Doc.
Ay, wow!
Yes.
Exciting.
Opo. Okay. Let's go to our TCM Foundations, number 166, Kidney Deficiency. Okay? So, as all we know, kidney focuses on strengthening the water generation and receiving aspect of the kidneys. It is also responsible for general moistening function, mga pagbabasa, of the other yin organs such as the lung and stomach, as well as essential to the regulatory health of our body. Okay? In essence, kidney yin is responsible for keeping our body cool and moist. Okay? Any problems with overheating or dryness can oftentimes be associated
Net,
with
magbilang ka na, Net.
kidney yin deficiency. Wait lang po. May nakabukas.
Okay, mute mo muna, Ma'am Neats. Thank you.
Opo. Okay. So, yun. Any problems with overheating or dryness can oftentimes be associated with kidney yin deficiency. Okay? Promotion of the health of the kidney yin can be directly related to the liver organ systems, as the kidneys are the mother of the liver, as seen through the eyes in Chinese medicine. This means the kidneys support the liver in all of its functions and essential for healthy liver organ system regulation. So, yun, importante ang liver. Okay? It is extremely easy to burn up your storage of yin and difficult to rebuild. So, parang sa bangko, madaling maubos, mahirap namang mag-deposit, mag-rebuild. Okay? Kidney yin tonics and qigong are a couple of few means to regain the element of yin. Okay? Kidney yin deficiency is one form of a more general yin deficiency with which it shares many symptoms. Okay? In fact, what you get really yin deficiency combined kidney syndromes and deficiency of yin essence. Yun yung dalawa. Causes ng kidney yin deficiency, loss of fluids. Paano nawawala yung fluid? Sa pagpapawis, perspiration. For example, during a fever, or yung diarrhea during the course of a disease, or loss of blood. Blood loss can occur kapag inooperahan. Siyempre, nauubos yung dugo, nagka-transfusion, and then nauubos yung dugo mo talaga kasi siyempre sobrang dami ng nawawala. From injury, yan. From heavy menstrual bleeding, yung malalakas, mag-menstruation, especially if it occurs over many months. Kapag parating every month, heavy menstrual bleeding. Okay? The latter menorrhagia at first exhausts liver blood, but then passes on to consume kidney too, okay? Because liver functions depend on kidney functions. And if you exhaust the child, the liver, you move on to exhaust the mother, the kidney. Mother and child, kidney and liver. Okay? Number 2, protracted chronic diseases. Yan. Yung mga chronic diseases, yung matagal na nating iniimbak ng mga sakit, it affects the deep energies or the zangfu energy organs of the body, being the liver, spleen, heart, and lung, and of course, kidney. All of these depend on the kidney function. So, if one of them gets exhausted, it ends up eventually with the kidney overstimulation. Okay? If you boost yang too much, you may exhaust yin's ability to keep up with it. Yan, yung coffee, yung caffeine, mga stimulants that eventually drain kidney yin kapag marami kang nag-take. So, lahat naman ng marami, dapat hinay-hinay lang, bawal. Okay? Herbs and drugs to boost yang, often to boost sexual energy, can do the same thing. Yun, alam nyo na siguro kung ano yung mga drugs na yun na nagpapalakas ng sexual energy. Masama rin pala pag marami. Some medications have the same effect. So, yan. Many social drugs, yung street drugs, yung binibili lang sa labas na hindi na kailangan ng mga reseta. Minsan nakaka-igi siya, pero pag na-overstimulate, nakaka-deplete ng yin natin. Okay? Overwork, of course, kapag maraming trabaho, may mental work, may worry, katulad ng studying, nakakaroon ka ng deficiency of kidney yang. Okay? So, symptoms ng kidney deficiency, yun, napag-aralan na natin to. Actually, paulit-ulit na lang. Low backache. Okay? It is not acute kind but chronic kind. Usually present after standing still or walking slowly for a while, often better when sitting or lying down. Mas malala kapag nag-carry ka ng mabibigat na mga bagay-bagay, or yung anak mo sa shoulder mo siya i-carry, shoulder mo. Masakit yung balakang. Sweating during sleep at night. This is not sweating that comes from a fever or from eating food that is too heating. Example ng food na yon, curry and alcohol. Okay, hot foods. But sweating that you cannot account for when the ambient temperature is not hot. Yung pinagpapawisan ka, hindi naman mainit. Para ako yata yun . It can be drenching and embarrassing. It is not considered to be a good sign in Chinese medicine as it shows that your body is leaking vital yang fluids. Okay? You notice the day after this kind of sweat that you have less vitality and may be more prone to upset or even infection. Humihina. Okay, katawan mo. Women during their menopause often sweat this way. And one of the first improvement they notice during good treatment is that these sweats abate. Hindi ko masyadong alam yun. Mouth and throat gel dry at night, when not necessarily so during the daytime. Natutuyo, mouth and throat. And yung urine darker than usual, at kokonti lang siya. Prolonged exhaustion, tiredness, and other symptoms after ejaculation. Okay. Then, there are symptoms which often take longer to appear or with age. Kapag tumatanda na tayo na papansin mo, ear noises known as tinnitus. This comes on very gradually, hindi bigla-bigla. In the first few months, you may notice it just when tired or in the evenings, but gradually, you notice it at all the time. Okay? It doesn't always interfere with hearing, though sometimes your hearing deteriorates at the same time. So, kaya pag nagkakaproblema na yung tenga, yun, humihina na yung kidney natin. Okay? Tiredness and lassitude, even depression. Yan. It leads to chronic fatigue. Dizziness. Pagka bigla kang tatayo o kaya matagal kang nakatayo. Yan. Or minsan, pagkatapos na umupo, bigla kang tatayo, nahihilo ka na. And then yung memory weak, yan, sign of aging. Aray ko. You find you can remember things from long ago, but not where just put your glasses. So, minsan yung hinahanap mo yung salamin mo, yung pala nandyan na sa mata mo, nakakabit lang. Concentration deteriorates. Hearing loss progressive. Not just night sweats, but nocturnal emissions. Hindi ko masyado maintindihan yung nocturnal emissions. Increase insomnia, yung lumalala na insomnia. Dry stools and constipation. Lack of fertility in women who have not reached the menopause. Infertile, di nagkakaanak. Well, kidney deficiency is not a killer, but it's slow and insidious and often leads to a range of symptoms that make you tense and anxious. It can raise your blood pressure and stop your sleeping well. So, lead on to chronic tiredness and lowered immunity. That means you start getting ill more often, okay? So, ang pulse, floating and empty. Tongue, normal. Normal color without coating. Yung walang coating. Treatment principle, enrich kidneyin. And then treatment, acupuncture treatment, we're going to use points. Bladder 23, REN 4, kidney 3, bladder 52. I-google na lang natin kung nasaan po yun. Kidney 6, kidney 1, spleen 6, lung 7 with kidney 6. It opens the directing vessel or the sea of yin. Ang gagamitin na technique ay with supplementation. Okay? So, you have to use other points. Depende sa symptoms. Kapag nahihilo, use or add DU20 or GV20, DU16, GV39. Okay? Pag may tinnitus, Sanjiao 17, Gall Bladder 2, Sanjiao 3. Kapag dry mouth and ito yung throat, kidney 2, Sanjiao 2. Kapag may tidal heat, sobrang mainit yung nararamdaman, lagyan ng kidney 2, heart 8, lung 10, pericardium 5. Kapag may lumbar pain, DU3, GV3 yan, covering vessel. Bladder 40 and bladder 60. Kapag sa seminal emission, dagdag nyo ang kidney 12, REN 6, heart 7, and stomach 36. Kapag may night sweating, SI3 and heart 6. Okay? Thank you very much. I hope you learn.
Thank you very much, Ma'am Needs. I'm sure marami silang na-learn. And please note that kidney deficiency is a very common pattern that you see in the clinics. Okay, let's move on now to acupuncture patterns and practice. Let's call on Sir Dino once again. Good evening ulit, Sir Dino.
Good evening, Doc. Good evening, classmates. Topic natin today is dementia. Dementia is caused by declining brain marrow masses, causing dysfunction of mental activities such as lack of short and long-term memory, as well as primary bodily function. So nawawala din yung body function. In mild cases, there are symptoms such as indifferent facial expression, reluctance to speak, slow reaction, and forgetfulness. In serious cases, the manifestation are saying nothing at all. So hindi na nagsasalita. Staying alone at home, muttering nonsense, or acting abnormally with sudden weeping and laughing, no appetite or food intake for several days. So walang gana po. In Chinese medicine, the syndrome of dementia mainly results from internal injury due to qi stagnation and blood stasis, clouding the clear orifices, or prolonged illness causing blood deficiency and brain marrow. Brain marrow depletion or kidney essence deficiency gradually resulting in brain marrow depletion and malnourishment. Wait lang. The basic pathogenesis of dementia is the decline of marrow and brain mass causing the dysfunction of mental activities. The location of the syndrome is in brain and is closely related to the dysfunction of the heart, liver, spleen, and kidney. So ito yung mga organ affected. The syndrome is characterized by Qi, blood, kidney essence deficiency as the root with the excess pathogens of turbid phlegm and static blood as the root. The commonly encountered syndrome in clinic is the deficiency and excess complex syndrome. This syndrome is commonly seen in disease such as senile dementia, vascular dementia, mixed dementia, brain atrophy, hydrocephalus with normal brain pressure, cerebral amyloid angiopathy, metabolic encephalopathy, and toxic encephalopathy. Sa clinical pattern differentiation and treatment. Sa Qi stagnation and blood stasis, ang symptoms is meron siyang dull expression, slow reaction, inhibited speech, forgetfulness, timidity, chest stuffiness, frequent sighing, distending epigastric pain, belching, rough and scaly skin, dark complexion, meron siyang dry mouth with no desire to drink, a dark tongue with ecchymosis or purpurus with a thin white coating, and a wiry and thin pulse. So yan so yung Qi stagnation and blood stasis. Sa treatment principle, we need to promote blood circulation to resolve stasis, open the orifices, and awaken the mind. So sa mga points, we have do 20 to open the orifices, awaken the mind, calm the spirit, and nourish the sea of marrow. EX-HN1, yung Shishan Kon to benefit the brain, calm the spirit, and awaken the mind. GB12, main point for treating mental disorder. Stomach 36, to promote Qi and blood circulation. Bladder 17, influential point of the blood to activate blood circulation, dispel stasis, and unbind the chest. Spleen 10, to promote blood flow and dispel blood stasis and calm the spirit. Supporting points, liver 14, the front move point of the spleen to spread liver and regulate Qi, harmonize liver and spleen. We have REN 17, ito yung front move point of the pericardium, and Sea of Qi to promote pectoral Qi and blood circulation and unbind the chest. So thank you for listening.
Thank you very much, Sir Dino. Any questions? Okay, so from acupuncture patterns, we proceed to symptoms, signs and symptoms. And let's call on Sir Alvin Palabay from Camarines Norte. Good evening, Sir Alvin.
Yes, the classmates. Good evening. All right, so nasa 49 na tayo ng signs and symptoms. So we're going to talk about polyps and flapping alenas. All right, so polyps sa full condition ng pasyente natin, pag may damp heat siya in the stomach and spleen, usually mga signs and symptoms, of course, may polyps, may sinusitis, facial pain, swollen ng nose, sticky taste, kasi nga damp heat, loss of sense of smell, feeling of heaviness, especially of the head, damp, a feeling of fullness and pain of the epigastrium and lower abdomen, poor ang appetite, a feeling of heaviness, thirst without desire to drink, nausea, loose stools with offensive odor, a feeling of heat, Right? May dull yellow complexion. Merong sticky taste. Of course, ang tongue niya is red with sticky yellow coating. And ang pulse niya is slippery, rapid. So, ang recommended acupuncture points. Sorry. Mabasa. REN 12, REN 9, spleen 9, REN 5, bladder 22. Sorry. Yeah. LI 11, yun yung mga points na for the in the stomach and spleen. So, other patterns with polyps. Okay, so pag ang diagnosis natin cold, dampness in the stomach and spleen, usually ang makikita natin mga signs and symptoms. Of course, may polyps siya, may loss of smell, white nasal discharge, meron na siyang facial pain, may headache, may feeling of heaviness of the head, abdominal fullness, loose stools, tongue with sticky white coating siya. Okay, so ang pulse niya of course is tapering. Pagka ang mayroon naman siyang phlegm in the lungs, of course may polyps, may cough with expectoration, kasi nga involved ng lungs of sticky sputum. Feeling of oppression of the chest, feeling of heaviness, so phlegm, swollen ng tongue is sticky coating, and slippery ang pulse. Right, so popping alinasin outside of the nostrils. So ito yung outside of the nostrils. Kapag ang pattern niya, acute na, yung acute pa lang yung kanyang lung heat. Okay. Merong, of course, flapping alinasin, flaring of nostrils, kasi nga may heat, red ang face, may cough, may slight breathlessness, may, of course, feeling of heat, may chest pain, may thirst, kasi nga heat, red ang face, of course, ang tongue red with yellow coating, and ang pulse is overflowing rapid. Alright? So, kapag ang problema niya sa nostrils, lung deficiency with empty heat, so slight flapping, alinasin, dry nose, dry cough, or with scanty, meron siyang sticky sputum that may be blood tinge, dry ang mouth, empty heat, and throat at night, weak or hoarse voice, night sweating, experience ng tiredness, manner plus, feeling a bit alone, great fever in the evening, and may 5-pound heat, thin ang body or thin ang chest, may insomnia, anxiety, tongue niya red, without coating. Okay, tongue deficiency. Ang pulse niya is of course floating empty and rapid simultaneously. Right? So, next slide please. Kapag ka-invasion of wind heat naman, so may wind heat. So may flapping, alinasin, aversion to cold, fever, like that siya, may cough, may sore throat, stuff or runny nose with yellow discharge, usually with heat, may headache, body aches, slight sweating, slight thirst, swollen tonsils, tongue is like red on the sides and the chest area or the front part, floating rapid ang pulse. So sa ulcers of the nose, pagka ulcers of the nose, kapag ang pattern natin na makikita sa pasyente ay lung heat, And then signs and symptoms, ulcer of the nose, red nose, dry nose, may cough, may, lung heat, may slight breathlessness, feeling of heat, may chest ache, clearing of nostrils, may thirst, red ang face, red ang tongue with yellow coating, ang pulse, overflowing rapid. Okay, kapag ang ulcers of the nose naman is caused by damp heat in the stomach and spleen, ang mga signs and symptoms, ulcers of the nose, swelling of the nose, right, damp heat in the stomach. So sticky taste, a feeling of fullness and pain of the epigastrium and lower abdomen, poor ang appetite, a feeling of heaviness, thirst without desire to drink, nausea, loose stools with offensive odor, a feeling of heat, full yellow ang complexion, sticky taste, red tongue with sticky yellow coating, ang kanyang pulse is slippery rapid. Okay, so liver fire. Pag liver fire naman, ang cause, ang pattern. Okay, so ang mga signs and symptoms, ulcers on the bridge of the nose, red bridge of the nose, headache, red face, dizziness, tinnitus, irritability, propensity to outburst of anger. It's common for liver fire. Thirst, bitter taste, constipation, dark urine, red tongue with redder sides, and dry yellow coating. Wiry rapid ang pulse because of liver fire. Kapag ang diagnosis or makita natin sa pasyente, toxic heat in the liver, mayroon na siyang ulcers on the bridge of the nose, nose pain, red, and swollen tongue, swollen nose, fever, red face, ocular eruption, agitation, headache, dizziness, tinnitus, irritability, propensity to outburst of anger, thirst, bitter taste, constipation, toxic heat, dark urine, and red tongue with red points, sticky, dry, dark yellow coating. Okay, so overflowing slippery rapid pulse. Okay, so number 21, papules on the nose. Kapag ang pattern na makikita natin is stomach heat, ang mga signs and symptoms, papules of the nose, burning, gastric pain, thirst, sour, regurgitation, nausea, excessive hunger, foul breath, a feeling of heat, red tongue with a yellow coating, and overflowing rapid pulse. Kapag lang heat naman, of course, meron ding papules of the nose, meron siyang cough, slight breathlessness, feeling of heat, chest ache, clearing of nostrils, thirst, red face, red tongue with yellow coating, and overflowing rapid pulse. Okay, so kapag ang diagnose natin blood heat in the lungs, init na, sobrang heat na, dark papules of the nose, cough, so of course nagka-cough na siya ng blood, slight breathlessness, feeling of heat, chest ache, clearing of nostrils, thirst, red face, red tongue without coating, overflowing rapid pulse. Okay, so thank you so much. Classmates, Doc Hector, thank you so much.
Thank you very much, Sir Alvin. Any questions before we continue or before we end with the last topic? Last but not the least. Okay, tuloy-tuloy tayo sa still on anxiety. Sir Aldrin cannot make it, but we are requesting the kindness of Ma'am Teresita Sumile to take over. Good evening, Ma'am Teresita.
Good evening po, Dr. Hector and classmates. Our topic for tonight is identification of patterns and treatment. Okay. Lung and heart yin deficiency. Clinical manifestations: anxiety, cough that is dry or with scanty sticky sputum, weak and hoarse voice, dry mouth and throat, tickly throat, palpitations, insomnia, dream disturbed sleep, poor memory, propensity to be startled, mental restlessness, uneasiness, dry mouth and throat in the afternoon or evening, tiredness, dislike speaking, thin body or thin chest, night sweating. Tongue is normal colored, dry without coating or with rootless coating in the front part. Pulse is floating, empty. Treatment principle is to nourish lung and heart, yin, and calm the mind. Points used are lung 9, Ren 17, bladder 43, bladder 13, Ren 4, Ren 12, spleen 6, heart 7, Ren 14, Ren 15. Methods used is reinforcing. Explanation for acupuncture points used. Lung 9, Ren 17, bladder 43, and bladder 13 are to nourish lung yin. Ren 4, Ren 12, and spleen 6 nourish yin in general. Heart 7, Ren 14, and Ren 15 nourish heart yin and calm the mind. Heart blood stasis. Clinical manifestations: palpitations, anxiety, insomnia, agitation, poor memory, chest pain, and the tongue color is purple on the sides, particularly in the chest area. Pulse is wiry, choppy, or firm. Mental emotional profile. This person will tend to be middle-aged. The anxiety is experienced more in the evening and often also in the middle of the night when they might wake up with a panicky feeling. Treatment principle is to invigorate heart blood and eliminate stasis and calm the mind. Points used are heart 5, pericardium 6, Ren 14, Ren 15, liver 3, spleen 6, and using the even method. Then explanation to acupuncture points used are heart 5, pericardium 6, Ren 14, and Ren 15 invigorate heart blood and calm the mind. Liver 3 invigorates blood in general. Spleen 6 invigorates blood and calms the mind. Another pattern is phlegm heat harassing the heart. Clinical manifestations: palpitations, anxiety, insomnia, dreaming a lot, feeling of oppression of the chest, sputum in the throat, slightly manic behavior. Tongue is red, swollen with sticky yellow coating, and the pulse is slippery and rapid. Mental emotional profile. In this case, the anxiety is marked to the point of agitation. The person may be hyperactive and slightly chaotic. Treatment principle is to resolve phlegm, clear heart heat, calm the mind, open the mind's orifices. Points used are pericardium 5, hearts 8, Ren 14, stomach 40, Gall Bladder 13, Ren 15, Groove 24, stomach 8, and then even method on all points except REN 14, which should be needled with reinforcing method. Okay. Explanations are pericardium 5 and heart 8, clear heart hits and resolve phlegm from the heart. REN 14 and stomach 40, resolve phlegm. GB 13, REN 15, DO 24, and stomach 8, calm the mind and resolve phlegm from the head. Yun lang po. Thank you so much for listening.
Thank you very much, Ma'am Teresita. If there are no questions, we will now take a break, and we hope to see you again later at 8 o'clock for Dr. Weblin's dry capping webinar. Good evening, everyone. Thank you po sa ating mga participants, especially sa ating presenters.
Thank
See
you
you
din
po
po, Doc.
later. Good evening po.
Thank you.
Thank you very much.
Good
Thank-
evening.
Thank
Thank you.
See you later. Bye-bye.
See
See
you
you
later.
later. Thank you to all.